Welcome to part 6 of 8, Essentials of Documentation. We are going to address some areas of mandatory documentation. So the Braden scale is an evidence-based tool that predicts the risk of developing a pressure injury. It uses numbers that range from a low of 9 to a high of 23. The lower the number, the higher the risk. 13 to 14 is a moderate risk, and under 13 is a severe risk. The prevalence of pressure ulcers in the ICU is very high, and generally the patients in SICU will score very low on the Braden scale. Is that because the care in the ICU is poor? No, absolutely not. It's in part because of the risk factors that our patients have. Patients with impaired perfusion are at high risk for pressure injury, so patients on vasopressors, patients in renal failure on dialysis, especially CVVHD, those with impaired nutrition status, either due to a chronic debilitation or prolonged periods of NPO, impaired oxygenation, so patients on ventilators due to hypoxia or other lung injury, those with impaired mobility, so maybe post-op patients or patients with chronic immobility, and especially those who are sedated and paralyzed. Like everything, you will be continually assessing your patient for risk, but the documentation of the Braden score is mandatory Q shift. In order for any tool to be useful, you need to use it correctly. So hover over each category to get more information. There are 6 categories within the Braden scale: sensory perception, moisture, activity, mobility, nutrition, and friction and/or shearing. So again, the documentation of the Braden assessment and the Braden scale is done Q shift. The Morse fall risk scale is something else that we document every shift, and that is mandatory. Again, you can hover over each category to better understand it and go ahead and document accordingly. In SICU, you won't see any yellow signs at the bedside or any falling stars or anything like that, because we really consider all of our patients at risk for fall. If they don't rule in by using the Morse fall scale, then they are for sure going to rule in because of the ABCS risk of injury scale. So no sign, but please go ahead and place the yellow fall wristband, and anybody that is ambulatory will be wearing the yellow socks. Note also that this is where we document what we did to prevent them falling. And don't just document, please do it. It would be a shame for your patient to fall because they were trying to reach the urinal, which is across the room. So you might think that elopement risk is irrelevant in the ICU, but untrue. We have had patients break their A-line tubing, disconnect themselves from the monitor, and escape down the fire exit and make it all the way out to 12th Avenue. So please, this is something else that we're going to be making sure that we document Q shift. So the learning assessment also is documented Q shift. This area is often neglected or skipped over, but please don't. Education is a huge focus of our accreditation agencies like Joint Commission. Also very important for legal and liability purposes. We had a kidney transplant years back whose family stated that the patient was never consented to the transplant and that education was not done in Creole, so that they didn't understand what was going on. When we audited, we found that there was actually no evidence that the consent was obtained with appropriate translation, but there was specific documentation in this area of charting, that the education to the family and the patient was done in Creole. So you want to really pay attention to the preferred language of the patient and make sure that the preferred language matches the language that they were taught in. If they're bilingual, you want to make sure that you specifically document that the patient is comfortable in English and has consented to that education in English. This example, you can see that the preferred language is English as stated on the banner bar, and you would go ahead and pick English as the language that they were taught in. So in addition, this is where you could fill in who you taught and how you taught them, and if there were any barriers to learning, which I'm sure there are. So you can see there are many details to be filled in this section, and please give it some attention. Thank you. So that's quite a lot of stuff to digest. We understand that, but please be very aware of these mandatory areas of documentation. develop good habits of including them with your initial assessment, knock them out, and then you don't have to worry about them for the rest of the shift. So that concludes part 6 of 8 Essentials of Documentation. Thank you again for your attention.